In the United States, carbon monoxide poisoning is responsible for 5,000 fatalities and at least 40,000 poisoning injuries every year. It has been the most common cause of accidental poisoning-related deaths for decades. Carbon monoxide poisoning is often called the silent killer because it is colorless, tasteless, odorless, and deadly. It is also referred to as the great imitator because its signs and symptoms are nonspecific, changeable, and mimic many different medical problems.
Hey John, hey neighbor, you got that car fixed yet? John!
Carbon monoxide, or CO, its chemical symbol, is produced as the byproduct of the incomplete combustion of wood or by hydrocarbon products such as home heating oils, charcoal, kerosene, and gas.
Yes, I'm over at my neighbor's, and he was working on his car in the garage, and I can't wake him up.
Carbon monoxide poisoning occurs when people inhale the substance. That inhalation generally occurs accidentally, and it's from a malfunctioning of some form of hydrocarbon burning material. Probably our most common events that occur are around the house and from a malfunctioning household appliance, typically a furnace, but sometimes a water heater. If something occurs from something as simple as a bird's nest or an insect nest in one of the ducts, it can cause the furnace or water heater to malfunction, producing much more carbon monoxide. And if that home is sealed up enough and isn't ventilated, carbon monoxide occurs in that environment and can poison people there. Unfortunately, some people get depressed and then turn their automobiles on, and occasionally they don't even realize that they may harm the rest of the members of their family or others in the building as they attempt to asphyxiate themselves with carbon monoxide. And then finally, people who work with power machines in certain settings, we now have gasoline-powered strippers, water jets, etc. They can be working down in a basement or an enclosed garage trying to clean, and as that gasoline burns in the motor, that exhaust is coming out producing carbon monoxide. The next thing we have someone unconscious on the floor, and it's the result of the use of some of those gasoline-powered small motors in an enclosed environment.
The most common source of CO poisoning is improperly vented or faulty furnaces, fireplaces, and heaters. Other sources include auto exhaust, gas-powered generators, charcoal grills used indoors, tobacco smoke, fires, small gas engines and equipment, gas appliances, and gas heaters used in enclosed spaces such as cabins, campers, pools, and spas. The use of any of these products in an enclosed area with poor ventilation increases the risk of CO toxicity. The CDC also has identified winter months, storms, and power outages as high-risk incidents due to gas-powered generator use indoors.
On the floor in the garage. I don't know what's wrong with him, but okay.
The pathophysiology of CO poisoning is complex, but the results are all very much the same. It prevents oxygen from reaching tissues, causing tissue hypoxia. Even at low levels, it can cause neurological disorders, cardiovascular problems, and respiratory disorders. Hemoglobin carries oxygen from our lungs throughout our body. Carbon monoxide has an affinity for hemoglobin and binds to it 240 times greater than oxygen does, easily displacing or preventing oxygen from reaching the hemoglobin. This creates carboxyhemoglobin, which further decreases the blood's ability to carry oxygen to vital organs. This can create severe physiological impairments, including cell death in vital organs, such as the brain and heart.
How are the CO levels?
They're in a safe range.
Okay, great. Let's get going here.
Those are relatively similar molecules down at that particular level. Carbon monoxide, though, binds much more tightly to the hemoglobin and doesn't allow it to then pick up oxygen and then take that oxygen and deliver it to the tissues. So carboxyhemoglobin deprives the body of places to begin to transport oxygen around to the cells that actively need it. Then, at the cell level, the CO will get offloaded by the hemoglobin, go into the cells, and poison the cells. The same sites that are looking for O2 molecules instead are bound up by CO molecules. At some point, that causes liquefaction of cells, causes short-term damage leading to long-term damage. And people who've had severe CO poisonings may suffer the same type of brain damage and long-term neurologic damage that people who have had terrible strokes or long periods of time without oxygen in a suffocation type of environment.
John, can you hear me? John?
How quickly the carboxyhemoglobin builds up in the body is a factor of concentration of the gas being inhaled. This is measured in parts per million, or ppm. Other factors that compound the effects are the duration of the exposure and the long half-life of carboxyhemoglobin. Half-life is a measure of how quickly CO levels return to normal. The half-life of carboxyhemoglobin is about 5 hours. This means it will take about 5 hours for the level of carboxyhemoglobin in the blood to drop to half its current level after an exposure. Even low concentrations of carbon monoxide inhaled over a long period are dangerous. The carboxyhemoglobin can accumulate over time, causing damage to cells and presenting the same symptoms as short-term, high-concentration exposures. CO poisoning is an occupational hazard for EMS and firefighters because of their regular exposure at the scene of fires. Other people who are particularly vulnerable to CO poisoning are those with existing health problems, elderly persons, infants, children, pregnant women, and unborn babies. Signs and symptoms of carbon monoxide poisoning are common to many other conditions and disorders. They are often so subtle, they are sometimes ignored, with life-threatening consequences.
Requesting ALS upgrade for unresponsive 50-year-old male found in enclosed garage.
The brain tissue reacts by sending out signals that we as humans usually interpret as a headache, sometimes a pounding headache. It affects the area of the brain that keeps our sensation intact and our GI tract performing appropriately. And now the nausea symptom begins to get added. And then finally it affects the nervous tissues that actually allow us to move, to retain our upright position, etc. And then we have near syncopal episodes or syncopal episodes.
The initial symptoms of CO poisoning are similar to the flu. However, no fever will be present. Most common signs or symptoms are headache, dizziness, weakness, nausea, vomiting, chest pain, and altered mental status.
Oh, hey, how you doing?
Good.
Good. We got a 50-year-old male who's been unresponsive for a little while. Was found in an enclosed garage.
Carbon monoxide poisoning can cause long-term nervous system damage. The cardiovascular system is affected, causing hypotension, dysrhythmias, and chest pain. Some of the symptoms can mimic myocardial infarction, angina, and anxiety attacks. A quick diagnosis and treatment is critically important.
Took them up to our SATs and our CO monitor and the cardiac monitor.
Fortunately now we have a tool that measures carbon monoxide level or carboxyhemoglobin levels through the skin with technology that replicates what we have in our pulse oximeters, and it's a step forward in how we're going to provide emergency medical care both in the field and in the hospital.
In the past, the only way to diagnose carbon monoxide poisoning was a blood draw and a time-consuming analysis in a lab. Improved technology now gives EMS a reliable way to diagnose with speed and accuracy in the field. A meter that, when applied to a patient's finger, can detect carbon monoxide levels in the bloodstream in seconds, along with pulse rate and oxygen saturation. Quick diagnosis of a poisoned patient also allows responders to identify other persons at risk in a toxic home or work environment.
Those non-invasive tools added to our toolbox are very important for us as EMS providers and for firefighters to use in rehabilitation and other sites where firefighters may be exposed. So this tool is a rapidly being implemented addition to our armamentarium for patient evaluation. The same tool goes into the emergency departments, and I believe there will serve as the sixth vital sign, particularly in the northern climates, particularly in cold weather, and particularly in people who may have symptoms that otherwise would remind us of the flu. I think we will find individuals who we otherwise would not have suspected had carbon monoxide exposures and may have been misdiagnosed as other things in the past. I think we'll find carbon monoxide is more of a problem than we anticipated.
Suspect CO poisoning anytime several symptoms are reported at the same time and no other cause can be identified, especially if more than one person at the scene reports similar symptoms. The severity of CO poisoning depends on 5 factors: how much carbon monoxide was actually present in the environment, the duration that the patient was exposed, the level of activity that was engaged in at the time, the age of the patient, and their general health.
Your friend Bill here found you passed out underneath the car and called us. How you feeling?
Trying to wake up.
Yeah?
There are 2 challenges to treating carbon monoxide poison patients. The first is to be able to recognize that they have carbon monoxide poisoning, and it's sometimes difficult for us to single out those symptoms that would make us suspect that disease. With a new tool that could be used more widely, like our CO meters placed on individuals' fingers, it will give us a much clearer indication of someone who may be at risk for that. The second challenge that comes along with the use of that tool is that once you have identified someone who has high carbon monoxide levels, you need to think immediately to where did they get those levels and who else may be at risk. So this is one of the very few tests that we do in the emergency system where an individual has a problem, and then we immediately have to look beyond that individual to the people that are around that individual, isolate the source of that carbon monoxide, address it to keep other people from having a bad outcome.
Treatment for any patient with suspected carbon monoxide exposure should begin immediately, but your safety is the first priority. Never enter a scene you know to be hazardous without proper protection. Follow your local protocols. High-dose oxygen is very effective in the treatment of CO poisoning. It works by increasing the total oxygen content of the blood until enough oxygen molecules flood the hemoglobin to displace the CO molecules. The CO molecules are then exhaled out of the body, and the oxygen delivery to tissues is restored.
First of all, we get the person away from the source of the carbon monoxide so that no further poisoning occurs. In a rescue situation, that may involve getting the person out of a basement if they were working down there with a power tool. If they were in a car, accidentally or intentionally breathing exhaust, get them away from that source. If it's possible and beneficial, then ventilating that area to remove carbon monoxide from other people as well. It may be, and we may learn, that then breathing ambient air is enough to clear the carbon monoxide fairly quickly. But to this point, what we believe is that by placing them on high-flow oxygen, typically an oxygen mask, that we can clear that carbon monoxide off of the hemoglobin much more quickly. As a matter of fact, early estimates are that 4 to 5 times as quickly we can clear carbon monoxide if we place the person on 100% oxygen.
After removing the patient from the source or ventilating the area, begin treatment. Evaluate the respiratory system and administer 100% oxygen therapy. Monitor vital signs and level of consciousness. Apply a cardiac monitor and CO oximeter and transport to the appropriate hospital. Remember, current versions of pulse oximetry cannot distinguish between oxygen on hemoglobin and carboxyhemoglobin. Pulse oximetry using traditional meters will falsely identify a high oxygen saturation level.
So here's the danger for someone who comes in who's got a headache, an influenza-like illness, saying the family and I don't feel very well, we've been sick at our stomachs, we've felt kind of washed out, and so we're all coming in to be checked for the flu. They enter the emergency department, they receive their vital signs. Their blood pressure would be normal, their pulse rate would be normal, their respiratory rate would be near normal. and their pulse oximetry reading may be 95 to 100%. The technology of obtaining oxyhemoglobin levels effectively eliminates the carbon monoxide bound hemoglobin, and therefore you get a ratio that is terribly inappropriate. And so those people, even though they may have very high carbon monoxide levels, would have normal pulse oximetry levels. And so that was a potentially fatal mistake. Misdiagnosis then of influenza would let the family members go back home, maybe be treated for their symptoms but receive no other treatment, and unfortunately those people would be going back into an environment where they could have a fatal outcome.
Hyperbaric oxygen treatment, HBO, is often recommended for patients with severe neurological symptoms. A pressurized oxygen chamber allows the lungs and skin to absorb more concentrated oxygen in a shorter time. Science has still not provided the exact indications for use of this treatment in carbon monoxide poisoning. Follow your local protocols regarding HBO therapy.
People who have neurologic symptoms, who have had a syncopal episode, who have appeared to have a stroke, who are clumsy, confused, disoriented, unable to care for themselves, may have been incontinent of their bowel and bladder contents. Those individuals have had significant brain effects from the carbon monoxide. And our current medical thinking is that if those people are placed on even higher flow oxygen, and in that way we mean hyperbaric oxygen therapy, that not only will it drive the carbon monoxide off the hemoglobin, but it may also drive carbon monoxide out of those important neurologic cells that otherwise would be doing those functions that we rely on them to do every day.
ALS care includes a further evaluation of the respiratory system, initiate an IV of normal saline, prepare for the possibility of seizures and dysrhythmias. For firefighters, the CO oximeter becomes an important part of the on-the-job protection and will reduce injuries and long-term health effects.
We're hoping that routine use of carbon monoxide meter at the fire scene in our fire rehabilitation operations will allow us to identify those firefighters whose levels are creeping up. We can let them sit, make sure that their level goes down, and make sure that therefore their rational thinking takes over, and we can avoid other injuries that otherwise would have taken place in those individuals. So EMS personnel who are involved with fire departments locally and involved in doing their firefighter rehabilitation operations may be using the transcutaneous monitor in that manner.
Remember to consider CO poisoning when responding to medical incidents where a patient's symptoms seem suspicious, or if they have been in environments that are enclosed. A quick diagnosis and treatment of CO poisoning is critically important in saving the first patient and preventing others from being poisoned as well.
With all of our patient encounters, we should learn to think beyond what the symptom is in front of us, what the individual patient has in front of us, to think whether there are other things that we can prevent or prevent harm to others. This is a tool that frankly tells us immediately we have to think beyond the immediate patient. A high carbon monoxide level in an individual has to be explained, and whatever the source is, it has to be identified, and we have to prevent other people from being harmed by it. So if you will, this is a demand bid by the patient to the treating crew, whether it's in the emergency department or in the field, that says go looking for the source right now and prevent other people from being harmed. That's an important lesson in all that we do in EMS. What can we do to move beyond the care of this individual patient to prevent somebody else from being harmed? I think that's a very valuable lesson for us to learn in EMS moving forward. One of the terrible tragedies of carbon monoxide poisoning is if we miss it in the index patient and then other individuals around that patient may be seriously harmed as well. There's a particularly horrible case that occurred in a northern city some years ago where an individual went into cardiac arrest, died at the hospital, apparently wasn't recognized as a carbon monoxide poisoning. When that individual died, the family was called into town for the funeral. Unfortunately, they stayed at the same house where that individual lived, and the original carbon monoxide problem, which was related to a furnace, was still present and was not suspected, and the rest of the family that came in for the funeral died as well.